We're honored and thrilled to have Greg Simon with us tonight. I'm going to summarize very shortly, but I can tell you that I can talk an hour about Greg. Greg is one of our nation's great advocates for innovation and medical research, and a leader in the fight to get treatments to patients as efficiently and as quickly as possible. He's currently the director of the Biden Cancer Initiative and was previously the executive director of the White House Cancer Moonshot Task Force, which was a position that Barack Obama gave to Vice President Biden. During his time in this position, he launched 70 innovative collaborations. As you all know, collaborations are hard. Can you imagine 70? That's amazing. He comes to his position with unique experiences in both public and private sectors, and he is able to bring people together, I can tell you that. He has previously served as Vice President Al Gore's Chief Domestic Policy Advisor, and he was also the CEO of Polywalk, which is a financial services company creating unique opportunities in healthcare and medicine. Previously, Greg was also Senior Vice President of Pfizer, and he was the founder of Faster Cures together with Michael Milken. And he was also involved in the Melanoma Research Alliance. I think you hear where I'm going, right? We have somebody unique tonight with us. And all on top of that, Greg is also a cancer survivor. So in addition to bringing all his government, corporations, doctors, researchers, and nonprofits experience together, he also brings the voice of the patients. So ladies and gentlemen, please welcome our keynote speaker of this evening, Mr. Greg Simon.
Hello, everybody. I have been dreading this because Annette has been talking about needing an inspirational speaker for tonight. And I'm thinking, you're the inspiration. You don't need me to be inspired. I've been reading up on you. I've known Annette for a long time. She's been stalking every event I've been at for the last year. She has heard every speech I've given, so that's another reason I was worried about tonight. But, you know, as corny as it may sound, at the Moonshot, we like to remind people that the moon doesn't have any light of its own. It reflects the light of the sun. And in the Moonshot, we were reflecting the light of groups like this that were taking on the challenge of doubling our rate of progress. All of the work we did, the collaborations, the government work, the work with the private sector, did not originate with us. It originated in those communities, and we were there to reflect that light and help shine it in other areas that might be able to help them. But I do want to say that when I was thinking about what I wanted to talk to you about tonight, I wanted to share with you a story I've never shared on stage about inspiration in my life. And it's a story that covers over 40 years. So most of you have probably never heard of Poland syndrome. Is anybody here heard of Poland syndrome? Okay. So I have Poland syndrome, left hand, right hand. And Poland syndrome, you're born with a webbed hand because it didn't separate because of generally vascular blockages. It's not a genetic thing, actually. And that's made hardly any difference in my life. But when I was a child, it made a huge difference because I loved baseball and basketball. And when I was 8 or 9 years old, I had a coach named Freddie Ronzeville, who was a factory worker making ambulances in my hometown. He had no children, but he was an incredible coach. And even though I was only 1.5-handed, he let me play basketball and Little League baseball because for him, it didn't matter if you were the biggest, the strongest, or the best. What mattered for him was whether you tried really hard all the time. His motto was hustle, hustle, hustle. So if you did that, you got to play. If you were the best player on the team and you didn't do that, you sat down. So if you looked at any of the pictures when I was in Little League of the team, every picture in the dugout would show me leaning up against Coach like this because he was my hero. Well, I called him Coach my whole life. And when I got to junior high and things got more serious, they didn't let me play at all. And every day when I would leave practice, I would just be enraged and in tears because I didn't even get a chance to practice, much less play in a game. And finally, the other most important man in my life, my father, said to me, "Son, God didn't put you here to play basketball. He put you here because of your brain. And that's what you need to be the best at. Don't worry about playing basketball. Use your brain." So the coach that first gave me the self-esteem to know that what matters is the effort you put into things, and my father who helped me focus on my God-given talents, were the two most important things that happened to me in my childhood that made me who I am today and helped me do whatever good I've been able to do. So now go forward to the year 2001. My father died in August of 2001 at the age of 91 of lung cancer. And I'm at the funeral home, and in the next room was my coach, who had died the same day. He had become a diabetic. He used to be an incredible fast-pitch softball player. He had had both legs amputated below the knee. He died of diabetes. And next to his casket was the picture of my Little League team with me right up against him. And at that moment, and I'm not a religious man, but at that moment I thought there has to be a God, because I was able to honor my father and my other most important man in my life on the same day and go visit his family. It was an incredible thing. So why do I tell you that story? Because in my work now with cancer, and in your work with NF, and all the other things I'm sure you're involved in, the most important thing is that we give it our all. You will not succeed quickly. There is no quickly in cancer. You may not succeed in the time that needs to help your relatives. But this race will be won by the people who devote themselves tirelessly to it and who make it their life mission to use their God-given talents to do something as important as save people from pain and suffering and death from things like NF. And when that story came to my mind as something I wanted to share with you tonight, it was because I am so moved by so many people that I meet who are doing what you're doing. You do not need inspiration. You need perspiration. You need people to take up the challenge and to do what has to be done. So let me talk for a few minutes about some of the work I've done over the years and what I've learned that gives me hope that we can solve problems like this and problems like glioblastoma. I was just talking with Rick about. I've lost a very dear friend to that who was 40 years old, 2 young children. She was diagnosed at the same time I was diagnosed with chronic leukemia. The time I finished my chemo, the same month she passed away, 18 months later. That cannot keep happening. We have to solve these problems. So when I worked on Faster Cures, Mike Milken had talked me out of leaving my own business to start a nonprofit after I'd been in the government for 12 years. So I was afraid I was going to be on my third wife when I went home and explained that I was going back into the nonprofit world. And my wife supported it, as she has in other nonprofit and government work since then. But when I was sitting there, what would you do if your mission was to change the way we do medical research and you're sitting there by yourself at a desk at a borrowed office? What do? Well, I realized fairly quickly that it wasn't all about me. I didn't have the answers. But I could read and talk to the people that were answering these problems in their own work in different foundations, in different diseases, who never talked to each other. So I did the logical thing. I brought all these groups together for a 2 or 3 day retreat in the middle of nowhere and asked, and this is the key to my career, is I asked the right question. What is holding you back? And let's talk about it with autism and epilepsy and brain cancer and breast cancer and lupus and ALS people all in the same room instead of at their own conference. And after 3 days, the answer was really simple, and they all had the same answer. Culture. It wasn't money, it wasn't science, it wasn't technology. It was the culture of the way we do things. As they say, culture eats strategy for lunch. And if we didn't change the culture, then we weren't going to be using money the right way. We weren't going to be doing science the right way. We weren't going to be doing clinical trials the right way. We were going to be doing it in the same way we've done it since World War II. Now, I spoke to a group of young people a few weeks ago who were in their 20s, and I mentioned World War II, and you get that look. There have been 2? Did we miss the first one? I'm thinking of doing a lecture tour called What You Missed. And when we got all those groups together and they realized they all had the same problems, then we started working out common solutions. So every quarter, that group would meet. And one time we would talk about the problem with academic research. Another time, the problem with investors. Another time, the problem with philanthropists. You know, all foundations have a problem with philanthropists. It's the same problem newlyweds have. When you date, you say a lot of things that might not be true. And then when you get married and you find out, oh, you're not employed? Why is the moving van stopping at your mother's house? And philanthropists tell foundations all the time, we're not going to tell you how to spend the money. Right. And the foundations always say, we're this close to a cure. Right. So they have a lot of work to do. It's therapy. But every quarter, we would meet with the problem community and start a candid conversation about how to get pharma better involved, how to get universities to move more quickly. So fast forward, Deborah Black, wife of Leon Black, who used to work with Mike Milken years ago, has her melanoma misdiagnosed by a Park Avenue doctor. It's not about money, it's about culture, for a year, and it went from stage 1 melanoma to stage 2, which makes all the difference in the world, because you can get rid of stage 1 and it won't come back, but stage 2 and beyond always come back. So we started the Melanoma Research Alliance, and they asked me to start it, and I knew zip about melanoma. So I started reading up on it. I read up on it so much that I could not look in the mirror to shave because I had med student hypochondria. And I started talking to my cancer friends who were leaders in their fields and other cancers, and I asked them a simple question. Where do you start this discussion to cure melanoma? And the answer was, you have to start it where it is, which is nothing works. That was their answer. Nothing works. If you start anywhere else, you're lying to them. So I said, oh yeah, these people who've been doing this their whole career want to hear me, Mr. 3-month expert, tell them nothing works, but guess what? Nothing worked. So we put 30 people, young and old, in a very small room at a hotel. I mean a very small room, like no room to hide, no room to be on your BlackBerry. And I started the meeting and I said, I know you've all been working on this, some of you for decades, but nothing works. Where do we go now? And the temperature rose. And the old guard started arguing, and the young guard just took them apart like a pack of dogs because they knew nothing worked. And they, surprise, surprise, the young people were the immunotherapists. They weren't the old guard. They were the new guard, and they had gotten no respect for years. And now somebody was listening to them. So we made a decision that day, which is something that you already know. A third of the money that they were going to put into this had to go to young people right out of their postdoc. A third had to go to team sciences that involve more than one institution. And a third went to the old guard. But if you ask Mike Milken what lesson he's learned from 20 years of funding prostate cancer research, he'll tell you, I made the mistake of funding people at the top of their career. They're not hungry enough. You need to fund the people who are young. They don't know it can't be done. They don't know it's too risky. So the Melanoma Research Alliance followed that model, and over the last 10 years, 7 years, they've helped bring to market these drugs that are literally getting people out of hospice beds and back into society, some of whom I've met myself. So now fast forward to the moonshot. What did I learn doing the moonshot? Now, I'm not going to tell you everything we did because you can look it up. You can't look it up at the White House. The White House has erased the Obama administration and climate change and health and lots of other things. So you won't see that on the website. But if you go to medium.com, social media site, and put in /cancer-moonshot, you'll see a description of everything we did, all the collaborations, all the reports. They're still there. You just have to look for them. So I found myself, it is funny how I got there. I was asked, how did you get there? Well, my career looks like a totem pole designed by somebody on LSD. I was a rock and roll drummer after college because I couldn't get into graduate school with my idea of doing a double PhD in philosophy of history and psychohistory. I was way too early for that. So I went into the next best thing, which was being a drummer in a rock band and traveling around the country, making a living at it, which is a point of pride. It also helps me talk to a group of 20-year-olds who've been drinking all night. And I went to law school, practiced for about an hour and a half, didn't like that. Came to Washington, got a job on a subcommittee. My boss got fired. I became the staff director, which never happens. I mean, I was here 6 months. I knew 3 people. And I became a staff director of a subcommittee. This is luck. This is luck. And that subcommittee happened to be on the science committee. So I learned a lot of science. How did I learn it? Well, David Botstein came in to talk about Hutchinson's. Jim Watson came in to push this crazy idea of a genome project. Francis Collins came in to talk about the cystic fibrosis gene. Jarvik came in to talk about the artificial heart. I mean, I learned it from the people who were doing it, which is a great way to learn that stuff. And 6 years later, my phone rings again, and I get asked to go work for Al Gore in the Senate. And I started doing information technology and telecommunications in addition to health and space program stuff. And to make a long story short, all of my jobs, and this is really bad for young people because they don't answer their phone, all of my jobs since I was in law school started with answering my phone. So if you're 20-something and you're unemployed, answer your damn phone. God does not text, okay? And he definitely does not tweet. We know that. I promised my wife I would be good tonight, but she's not here. So I'm in New York. I'm running my finance company. I had just finished chemotherapy for chronic lymphocytic leukemia, which could not have gone better. I was totally lucky guy. Found it through a physical, which I don't even believe in, but my doctor wouldn't renew my Ambien prescription for my travel if I didn't get a checkup. So I got a checkup, and this is, pardon me from being, I'm going to do a little sidebar here. I got a physical, and then 4 days later, I hadn't heard anything. And I'm on an airplane to San Francisco, and I land, and it's like, God, if I don't call my doctor right now, he's going to be closed, and then it's Friday. He doesn't work on Friday, and I won't know till Monday. So I call my doctor while I'm getting my bag down. You know those people that you really hate when they start talking when the plane lands? That was me that day. And I'm like, hey, I call my doctor. He says, oh, I'm so glad you called. Remember that. He was glad I called. I don't get paid for calls either, by the way. Your cholesterol is really good. Your PSA is good. But by the way, anytime you hear by the way, duck. You have leukemia. I said, now remember, I'm on a plane, right? And I've got a bag up. I said, by the way, I have leukemia? Didn't you kind of bury the lead here? Isn't that, like, he shouldn't have said, oh my God, Greg, you have leukemia. And your PSA is okay, and your cholesterol's okay. But no, so he said, you better get that checked. Duh. So I happened to be visiting a doctor. So I called him and said, hey, I have leukemia. I'm coming to your place, need to check my blood. He said, okay. So he didn't know what kind I had. He didn't know if I had 10 years or 10 days. So I went to his office. They drew my blood. It was even worse than the number my doctor gave me. But if you know people who know people, which is an awful way to have a network, but it's the one we have, we were able to consult with UCSF, and they said, you're safe to fly, you're safe to live, you have a lot of white cells, but your red cells are good, blah, blah, blah. So a year later, I get treated, and 6 months after that, I'm done. So I'm walking down the street, and my phone rings, back to the story, my phone rings, answered the phone, and they said, Vice President Biden would like to meet with you tomorrow morning to talk about the cancer moonshot. And I'm like, well, I'm in New York, and I have an appointment with my leukemia doctor tomorrow. Oh, okay, well, we'll schedule another next week. I said, okay. So I hang up the phone, and I go, what am I, an idiot? And so I call my doctor. It's like 9 o'clock at night. He's a nice guy. He likes me. I like him. He's a cellist. I'm a cellist. It's one of those things. And he's a leukemia doctor, and I have leukemia. So we have a lot in common. So I call my doctor, and he says, what's up? And I say, well, I just got this call from Joe Biden's office that he wants me to come and talk about running the cancer moonshot, but I have a checkup with you tomorrow. And he said, what, are you, an idiot? He said, well, you can see me anytime. Go. I said, okay. So I called them back. I went, and I go see Joe Biden, and I'm there for 30 minutes, and as is his style, he talked for 25. It was the easiest interview of my life. And I met his wife the next week with him at his home, and he said, let's do this. I said, okay. You tell my wife. So I've ended up back in the government, and here I am again. Now I have one person working with me, a wonderfully brilliant, hardworking woman named Danielle Carnival, who was my chief of staff in the White House and is now my deputy at the Biden Cancer Initiative. She was the person assigned to me. She didn't get a choice. And what do? We're supposed to run 20 agencies into doubling their rate of progress in cancer. What do? What would you do? Well, how would you measure that? What would you ask them to do? So one of the reasons they asked me to do this was I had dealt with complex topics when I was in the White House the first time that involved 20 agencies and all of Congress. It was the Telecommunications Reform Act, which involved pretty much the entire economy, and everybody had an opinion, and we got it done in 3 years. So I thought long and hard about this, and I looked at the materials they had submitted for the first meeting, which happened before I got there, and there were PowerPoints, and they had things like, goal, get 10,000 more people into clinical trials. I'm like, okay. Pfizer alone has 150,000 people a year in clinical trials. What's 10,000 got to do with anything? So I looked at all the other goals, and they were like little bitty goals. So I thought, okay, we have to train their brain differently. So I thought, how do I do that? And this is what I did. When we had the meeting with a group of people who were not happy that they were being asked to do something hard the last 10 months, I said, listen, I know you all think in terms, I've been here I know you think in terms of programs and budgets and expanding the program and expanding the budget. That's not what we're here to talk about. Here's what we're here to talk about. I want all of you, and there were people in the room, the National Endowment for the Arts, NASA, USDA, EPA, NCI, NIH, the whole alphabet soup, DOD. I said, here's what I want you to do. I want you to figure out where and how you touch patients in their journey from prevention to detection to diagnosis to treatment to survivorship. Where do you touch them now, and how is that going? And how can you double the impact of that in half the time with the money you have? That's the question. That's the question. And the answer has to include partnering with somebody else around this table you have never worked with before. They had the same reaction you had. Total silence. And that's good, because I could tell that inside their head, and that little voice that's always ready to argue the moment you hear something, right? If you're married, you know exactly what I'm talking about. That little voice said, God, I don't have an answer for that. I thought he was going to say double your budget. I can't do that. Or just double your program, and I don't know which one. But they didn't know how to respond to that, which was the point. They had to go back and think about it and feel about it. And that's what made it a success. It's because when they came back, the National Cancer Institute's starting to partner with NASA, using their radiation laboratory to test carbon ion beam radiation. DOD starting to work with the Department of Energy to use the Department of Energy's incredible supercomputers to analyze medical records and tissue slides that have never been digitized. The VA partnered with Walter Reed Hospital, which, unbeknownst to everybody in the world, had one of the best sequencing facilities in the country. And now they'll sequence the tumors of people in the VA for free at a facility in Rockville that can do it in a matter of hours. And IBM Watson agreed to review those mutations against all the medical literature in the world and spit out the known therapies that work the best, which they could do in an afternoon for free. When the VA announced this, the deputy of the VA, who's now the secretary of the VA, said it was the first good press the VA had gotten in its history. And I don't doubt it. I don't doubt it. So I promised you I wasn't going to go through all the examples, but let me just put it this way. A year ago on June 7th, we had a summit at Howard University. We had 400 people there. Biden spoke, few people spoke, but most of the time it was a workshop, not a talk shop. And that was cool. That was fun. It was useful. It was very useful. But the headline was there were 7,000 people at 270 individual workshops in every state of the Union, including the territories of Puerto Rico and Guam. That was the news. And that is when we knew that the moonshot had gone from a program to a movement. Which leads me to the next point, which is what now? Is there still a moonshot? Is there still hope that the government's going to be part of this? And the answer is yes. And the reason the answer is yes is because it doesn't matter if there's a moonshot director at the White House. What matters is there a moonshot director at your house, right? Because the moonshot really was reflecting the light of the people who took this on because they believed in it. Because, as someone stole my line at the cocktail party, told me, if you don't believe it can happen, you will never make it happen. I'm one of those people who believe that believing is seeing. Believing is seeing, not the other way around. So the agencies that were doing all these great things are still doing all those things because career people were in charge with their current budget and because it was related to their mission. And you would have to be incredibly venal to go into any of these agencies and say, stop doubling the progress on cancer. What do you think you're doing? That is not going to happen even in this administration. And the private sector is going gangbusters. We, the Biden Cancer Initiative, can't even keep up because there are only 3 of us right now. We're launching the Biden Cancer Initiative as a freestanding nonprofit. We're raising money right now. It's taken us a while to get organized and incorporated and all that stuff. But we're going to be doing what we do best, which is use Joe Biden's passion and authenticity and ability to bring anybody in the room with anybody else and make them do things, to look at the problems that you all have done such a terrific job of addressing. Standardizing pathology, standardizing cancer terminology, sharing data of all kinds, whether it's hospital records, doctors' records, outcome records, clinical trial records, research records. Changing the way we do clinical trials to let patients be part of the designing from the beginning. Dealing with the cost of medicine and access to medicine. We cannot have people who cannot afford life-saving drugs. We have to find a better way of doing this, and we can. But you need someone like Joe Biden to bring those people into the room and say, the status quo is not acceptable. Here are 10 ideas of what we could do better. Let's go through them and let's pick the ones you're willing to do, and not stopping until we get there. That is what we can do to make the moonshot a real living thing. Now, I know one thing that Annette talked about was pharma. So when I went into Pfizer, the CEO called me to bring me into Pfizer. He said, I'd like you to help change the culture at Pfizer, the way you did at Faster Cures. So I went into Pfizer by myself. Now, as I said, I'm not a religious person, but even the Son of God thought he needed 12 people to help him change things. So what was I thinking going into a major pharma company by myself to change things? So I learned a lot. And what I learned was the people who worked directly for me were the least interested in changing things because it's scary. But there were people who did not work for me who wanted to work with me because I was senior enough to make things happen that they had been hoping would happen for a long, long time. And one of those things was to get pharma to realize that they shouldn't just be giving money to foundations. They should be taking money from foundations who want them to work on a problem that otherwise they would never work on. Just as cystic fibrosis funded Vertex for 15 years, I brought 9 foundations into the head of innovative therapeutics at Pfizer and said every one of these groups wants to give you millions of dollars because only a company like yours can develop what they need to cure their people. Some people at Pfizer thought it was immoral to take their money. I said, come on, it's capitalism. You're not going to pay attention to them if they don't pay you because it's not your priority, but they're living and dying on this problem. So guess what? Now they take the money. They take up to $100 million a year from rare disease groups and orphan disease groups to give them hope that, yes, they'll put some of the best scientific minds and facilities in the world to work on their problem and share the cost with these groups. And that is the way it has to work because without collaboration among the government, industry, academia, foundations, we won't get there. It is a team sport. It is a team sport. So in 2003, I asked foundations every chance I got to do what you're already doing. Your repository, your tissue bank, meetings like this where you reinforce the notion not to duplicate what's going on, not to chase the NIH, but to chase the risky, to chase the immediate, to chase the urgent. And that's why I go back to my opening comment. I'm not here to inspire you. I'm here to thank you for getting it right and for getting it right so soon in your life as a foundation. And to thank you for giving people hope, not the kind of hope that's just in the air, like, I hope you'll end that investigation soon. But the kind of hope that says we're going to get it done, right? The kind of hope that says, I hope you take chances to cure NF. That is not a wish, that's a demand, put nicely, right? I hope you let patients take risks in clinical trial. That's not a wish, that's a command to the FDA. Let us take chances. The kind of hope I'm talking about is the kind of hope that's backed up by years of work, by thousands of patients putting their life on the line, and by people like you and Rick and Annette and all the people in the foundation who are willing to take the risk to help all of you live a long and healthy life. So I am not here to inspire you. I'm here to be inspired, and I am. And I thank you so much.